Everything you need to know in 10 minutes about Tadalafil. This is undoubtedly one of the most widely used medications in the world for male sexual health. Today, we are going to explain, in a clear and simple way, exactly how it works, what it is used for, the new indications for use, who absolutely cannot take it, the main side effects, whether Tadalafil actually causes dependency, and the very latest scientific updates on this topic. If you are new here, make sure to subscribe because this breakdown is going to be extremely complete. Let's get straight into it. Tadalafil is a medication belonging to the same class as Viagra, but you can think of it as a slightly more modern version. It emerged in the early 2000s, following the massive boom of Viagra in the 1990s. Both medications belong to a class of drugs known as phosphodiesterase type 5 inhibitors, or PDE5 inhibitors. However, the major difference between them lies in their duration. While Sildenafil, known famously as Viagra, has a half-life of roughly 8 hours, Tadalafil, specifically the 20 mg dose taken 1 hour before intimacy, can remain active in the body for up to 36 hours. This extended duration is exactly what earned this medication its famous nickname, the weekend pill. It is crucial to remember that Tadalafil does not work on its own. Just like any other medication for erectile dysfunction, it must be associated with a sexual stimulus. This stimulus can be sensory, visual, olfactory, or tactile. In other words, a man needs a trigger. Without that arousal trigger, Tadalafil will not simply create an erection out of nowhere. Rather, it facilitates and supports the erection once that signal is present. Biologically, this medication acts by increasing the concentration and bioavailability of nitric oxide within the blood vessels. Nitric oxide is the primary vasodilator involved in the mechanism of an erection. Essentially, it relaxes the blood vessels, specifically the cavernous arteries of the penis and the vessels within the corpora cavernosa, allowing more blood to enter and remain trapped in the penis. This process favors penile tumescence, resulting in a firmer and longer-lasting erection. Regarding timing, the substance typically begins to act within 40 to 60 minutes after ingestion. However, the peak action of Tadalafil, when it is most potent in the bloodstream, usually occurs 2 to 3 hours after taking it. And as mentioned, the effects can persist for up to 36 hours, which is significantly longer than the 8-hour window provided by older medications like Sildenafil. In the pharmaceutical industry, the most common and widely used presentations of Tadalafil are tablets, typically found in 5 mg and 20 mg doses. However, in compounding pharmacies, you might find other forms of presentation, such as sublingual sprays or lozenges. You may also encounter combinations that are generally not indicated and can be risky, such as subcutaneous hormonal implants or chips that mix testosterone directly with Tadalafil. So, how should one utilize this medication for the best results? There are 2 main protocols for using Tadalafil. The first is on-demand use. This involves taking a 20 mg dose approximately 1 hour before sexual intercourse. The second is daily use. This involves a treatment dose of 5 mg taken every single day. This daily protocol is often ideal for men seeking more spontaneity, as it removes the psychological burden of having to take a pill right before sex. It demedicalizes the moment, allowing intimacy to happen naturally without watching the clock. This daily 5 mg dose has another significant indication. It is used in the treatment of benign prostatic hyperplasia, or BPH. This refers to men who are experiencing urinary symptoms related to the benign enlargement of the prostate. Tadalafil acts on the smooth muscle of the prostate and the bladder, improving urinary flow and bladder emptying. Therefore, for patients suffering from BPH, the daily dose serves a dual purpose. However, a very important observation must be made here. Many people believe that Tadalafil shrinks the prostate. This is false. Tadalafil does not reduce the size of the prostate. It merely improves the urinary flow by relaxing the muscles. Therefore, for patients with extremely large, voluminous prostates, Tadalafil alone is often not enough to treat BPH, as it is incapable of reducing the prostate's volume even when used over the long term. It is also important to note that there is no single dose or standard treatment that works best for every man. The ideal medical approach is to start with the lowest effective dose and adjust according to the individual patient's response. The primary indications for Tadalafil usage are, firstly, erectile dysfunction, which is the most well-known use. Secondly, it is used for premature ejaculation, specifically in patients who suffer from erection difficulties associated with a lack of ejaculatory control. In these cases, Tadalafil might be prescribed in conjunction with other medications, such as paroxetine or duloxetine. And thirdly, as mentioned, for the treatment of urinary symptoms caused by benign prostatic hyperplasia. Now, we must address a difficult reality. Tadalafil does not work for every patient. Studies show that approximately 35% of men do not respond well to treatment with Tadalafil for erectile dysfunction. This percentage of failure is even higher when we look at diabetic patients, where the failure rate can reach up to 44%. Furthermore, when evaluating patients who have undergone prostate surgery for cancer treatment, such as a radical prostatectomy, the chance of failure with Tadalafil is even higher. For these reasons, medical supervision is fundamental. In some cases, a patient may require a combination of treatments rather than relying on this medication alone. A very common question among men is, does Tadalafil cause addiction? The answer is no. It does not cause physical or chemical dependency. Your body does not chemically crave the drug. However, there can be a psychological dependency. A patient may get used to the enhanced performance provided by the medication and begin to lose confidence in their ability to perform without it. This is particularly common in young patients who use the drug recreationally without any medical indication. These are often healthy young men with no comorbidities and no physiological erectile dysfunction who use Tadalafil to boost performance, impress a partner, or, in some ill-advised cases, to enhance blood flow for gym workouts. This recreational use creates a psychological crutch that can be difficult to break. Regarding side effects, while generally safe, Tadalafil is not without issues. The most common side effects include headache, nasal congestion, a feeling of having a constant cold, back pain, and muscle aches, particularly in the legs or lower limbs. Some patients also report gastrointestinal issues like heartburn or acid reflux. For most, these symptoms are mild, but for some patients, they can be strong and even incapacitating, forcing them to stop the medication. If you fall into that category, or if you simply hate the idea of relying on synthetic drugs that act as a temporary band-aid, there is a powerful, 100% natural alternative you need to know about. It involves a simple, 7-second daily habit with a unique purple tonic that targets the biological root cause of dysfunction rather than just masking the symptoms. I found a video that explains exactly how this natural remedy works to restore firmness and stamina without the nasty side effects. Go ahead and point your phone's camera at the QR code on the screen right now to watch it, or simply click the link I've pinned in the top comment below. It could be the game changer you've been looking for. There is, however, one major, absolute contraindication. Patients with heart conditions who utilize nitrates cannot use Tadalafil under any circumstances. Nitrates are found in medications often prescribed for angina or chest pain, such as isosorbide dinitrate or mononitrate. Because both nitrates and Tadalafil are potent vasodilators, taking them together can lead to a catastrophic drop in blood pressure, leading to cardiac ischemia, heart attack, stroke, or even death. If you take heart medication, you must consult your cardiologist before even considering Tadalafil. Finally, what is new in the world of science regarding this drug? Recent studies have begun to show that Tadalafil may have benefits that go beyond erections and the urinary system. There is evidence pointing toward an improvement in vascular health, specifically regarding endothelial protection, improving the lining of the blood vessels. This potential protective effect might extend to cardiac health, offering a degree of cardiovascular protection. Furthermore, some studies are signaling potential protective effects against neurological diseases, specifically those associated with senile dementia and aging, likely due to improved blood flow to the brain. However, it is vital to be clear. These studies are still in developmental phases. We do not yet have robust enough conclusions to prescribe Tadalafil specifically for heart protection or dementia prevention, but the research is promising. Another common question is whether Tadalafil works for women. Some studies are currently underway regarding female sexual dysfunction, but as of right now, there is no solid evidence or official indication for its use in women. In conclusion, Tadalafil is a safe and effective medication when used with proper medical guidance and prescription. It is a powerful tool, but it is not magic. It does not work for everyone, and it must be treated with respect. It should never be used for self-medication.